My mother, surgery, injury, IVF, childbirth. These are the different reasons why I decided to become a nurse. Hi, my name is DeLacy Anderson, and I am married to a wonderfully supportive husband. I have two beautiful children. I was born and raised in Orange County, California. The weather here is nice all year round, as most of you know, which is why I get to spend majority of my time at the beach, my favorite place to be. I am currently enrolled in the nursing program at West Coast University. I was first exposed to nursing at a young age. My mother was a nurse through my life growing up, and I remember her bringing home books to try to better herself and her career as a nurse, and she used to bring home injections so she could practice on me and my 7 brothers and sisters. I, for one, used to run away from her, but would come and watch when she injected my brothers and sisters as I was intrigued to see what she was doing to them. And I remember visiting her at work and seeing what she did there, reading heartfelt thank you notes from patients of hers, and just really realizing how she touched lives and how thankful and grateful people were for the job that she did for them. And at this point in my life, I was young and didn't think I wanted to follow in my mother's footsteps, so I didn't realize I wanted to become a nurse, but I knew I was intrigued and interested in all of that. And then I ended up having my two children who I gave birth to, and then, witnessing the hospitals and childbirth and the medications that come with it and all of those different factors of the medical field, I really thought, wow, this is interesting. And at that point, I then carried other people's children for them. I was a surrogate and got to experience the medical field from that part of it, where I witnessed the different medications that I had to take for that, and different nurses, different hospitals, and their protocols that they had for that. And, trying different ways of childbirth and seeing the different effects and all of that. I ended up on bed rest with the twin pregnancy as a surrogate, and it was hospitalized bed rest. And I remember playing with different machines in the hospital while I was there, and the nurse, used to tell me to call her if I had to get up out of bed, but I remember pushing buttons myself and getting out of bed on my own because I thought I could do it, and didn't feel like I needed her help. And I was kind of just interested in how the machines worked anyway. So if I got up or moved, they would beep and I could turn them off. And it was at that point that I realized I wanted to be a nurse, but I didn't pursue it any further because I, for one, didn't realize how long the nursing path could take and how important and crucial all the different steps of nursing were. And then, my career was pretty steady. I was working as a case manager for surrogacy and got to experience IVF. Through the IVF, I was just amazed at the different many factors that came with IVF and how these doctors can make a baby in a dish at a lab, and a surrogate can carry another couple's biological child because these doctors created their baby in a dish. And at that point, I knew I wanted to be a nurse, and this was my calling. I was meant to help people, and I wanted to help people, and wanted to just experience so many different things of medication and the medical field and how things worked, because through IVF, I was just shocked at how hormones can affect a body and how you can make your body think you're pregnant with just these hormones, and all the different factors that came with that. So, my mother, childbirth, surgery, injury to family members, these were all reasons I knew nursing was my calling, just experiencing these. Through my life, I didn't realize that I would know what I wanted to be when I grew up. I always was one of those kids who didn't know. I didn't have an idea what I wanted to be. It was always a question in my mind, what do I want to do? Where do I want to be? And little did I know it was right in front of me the whole time, being a nurse. And here I am today, on my way to nursing, going through this program with all of you, and just excited, and nursing is my calling. This is where I'm meant to be. Thank you for taking the time to listen to me.